Alrighty, everyone, good afternoon. So I said that I was going to be doing a video for strategic therapy. Had a few people asking me about this model, about this theory. This is actually one of my favorite theories. I loved learning about strategic therapy because I found a way to put it so that I could better understand it. One of the things that I am going to say is I like to be silly when it comes to this theory. It's a lot of things in here that I just had to just like really take light of when it came to learning about this theory. I use this, one of my favorite books here, Karam, and then I also used Volini's book as well, but I can't seem to find that one. I don't know where it is right now. But yes, I use this book and I use Volini's book to have a better understanding of it. Actually, Karam's book goes into a tad bit more detail regarding strategic therapy than Volini's does. But Volini's, the way it's structured, I like that one better. But yeah. So I wanted to do strategic therapy. I had people asking me to talk about it, and I sure don't mind a bit. So as you can see, I have Jay Haley, Milton Erickson's, and then I also have Chloe Madane's. So here's the thing. I learned about the different other people that paved the way for strategic therapy through Family Solutions Institute. Milton Erickson, I learned that he was an influencer for Jay Haley and the strategic therapy approach. And then there's this other guy, starts with the letter W. I don't know how to really pronounce it, but he was a student of one of them or something like that, and he also gave some insight on this theory as well. So yes, here we are. We have Jay Haley. He's one of the famous names for strategic therapy, and Chloe Madane's as well. So when we look at strategic therapy, we think about power, we think about hierarchy, we think about those clear directives, right? And that role of that therapist is what? Problem focused, and they are authoritative. They tell you what to do. I love it. I love the strategic therapy approach. Like, I'm telling you what to do. This is what you need to do, because obviously y'all can't seem to find the solutions. I have the solutions. I'm the therapist. I know what it is and I'm doing. Clear directives that they tell you this is what you need to be doing in order to stop those disabling sequences that you seem to keep having. So here we go. You don't have to look at the words on the thing. This is just here for me as a reminder as I talk. I typically freely talk about these theories, but I want to just have a reminder because I don't want to miss anything when I am teaching you all. So when it comes to directives, there are straightforward and indirect directives that are there, right? Straightforward tasks are the ones that the therapist is going to give, that the clients can easily follow, and the therapist knows that this family or this client is going to do it. Those indirect ones and those paradoxical interventions that we've been talking so much about are more of the resistant ones. The therapist seems to think that they might not do it. So then now I'm going to sign a paradoxical intervention. It might sound weird, it might sound crazy, but I want to see if you are going to do it in the first place, right? So then we also have those ordeals. These are the fun interventions that you can use, right? So that is like the one that's more like unpleasant first. Do those 50 push-ups before you do such and such or whatever. And then it lets us know, well, I guess you can give up that symptom, right? I guess you can stop doing what you're doing, right? It encourages the clients to give up the symptom. It's better for you to give it up than to keep it. Do those 50 push-ups first, and then you eat that piece of cake since you like to eat so much, right? And then we also look at unbalancing. Don't be misconstrued, because unbalancing is also structural therapy, and we'll get to that as well. But this is a fun part about it. Now I get to take a side when I'm in therapy, right? Oh, y'all want to pick on this kid over here? Well, I'm going to side with them. I'm going to throw off these little coalitions and stuff that you all have. I'm going to throw off the the hierarchies that you all seems that you have by taking a shift from, this one thing over here that I'm just paying attention to, but no, somebody is getting ignored over here. So now I'm going to side with this person. That's unbalancing. Temporarily, I am going to be an ally to this person that you all seem to pick on so much. That's unbalancing. Same thing for structured therapy. It means the same thing, right? And then we got those nice little paradoxical interventions. That's prescribing a symptom, instructing a client to do opposite. Just like we just talked about in the other video. Do this instead or whatever. And it's like hoping that they are going to not do it, or whatever the case may be, right? And then there's the good old reframe that you have. We're just going to look at it differently. We're going to look at it more positive or whatever, right? You got this little behavior that's going on over here or whatever, but let's try to create some motivation behind that. It's not so bad as it seems, right? We're just going to do a little simple little reframe to see how they're going to look at it differently, right? These are some of the key terms for strategic therapy. There are other terms for strategic therapy, but these are some of like the main ones that are discussed in Eli Karam's book and in Volini's book, right? Just the key terms, just the gist of everything. You'll learn more and more and more once you study the questions and everything for it. So let's go ahead. In therapy, who's involved in therapy? Not all family members. He said, hey, I don't need all y'all here. All I need is the one that's like directly related to the problem. But I need mommy and I need daddy. Bring mommy and daddy to me, right? Everybody else doesn't have to be there. Only directly related to the problem. If it's more people that's directly related to the problem, then hey, they're there. But mommy and daddy has got to be there, right? And then we look at this. The goals of therapy. The overarching goal of strategic therapy is what? We are looking at symptom relief. The disabling sequences that I keep talking about. I need those disabling sequences gone. That is where you are going to get your relief from, right? Changing of the family structure. Don't look too deep into it because I know that's a structural therapy thing, but strategic therapy is also about hierarchies, right? It's like some of those questions. Mommy and daddy doing this. The son is doing this. Now you're triangulating me. I got to get these hierarchies fixed. Parents up here, the children and stuff are down here just like it always is, right? Symptom relief. Once that symptom has been resolved, boom, one and done, right? But first, let's get to the phases of therapy. I've had a lot of people that were like confused by this and was like, well, isn't this like the first, initial, middle, and end? No, the very first session has all of these stages that you see here. Social problem interaction goal setting happens all in the first session. Do not get that confused with the middle phase and the late phase of therapy. The social stage is exactly what it is. It's a conversation. Don't look too much more into it. The problem stage is exactly what it is. And now we're talking about the problem, but I need to get everybody's perspective from the problem. Interaction stage, just exactly what it is. I'm watching. The therapist is watching power dynamics, coalitions, finding out who has more power, who doesn't have more power, where the imbalances is coming in the family system. And the goal setting stage, exactly what it is. Now we got to start setting those goals. What are we going to do? What is it that needs to be changed? What do we need to work on? What should the therapist assign for them to do? The middle stage is crucial when it comes to answering questions. If you see a vignette that says, what would a strategic therapist do in the middle stage of therapy, you better be ready to be looking for interventions. Interventions are used in the middle stage of therapy. Directives, straightforward directives, paradoxical interventions are used in the middle stage of therapy. They are focusing on changing those behaviors that continue to maintain in the system by using these interventions. Disrupt the interaction sequences, using ordeals, using prescribing the symptom to make sure that the problem maintaining that continues to maintain is going to be done for, right? Here we are. These are your example of your paradoxical interventions that are used. You got prescribing the symptoms. And I put examples up there. I pulled some of these examples because these are some of the main ones that I've been seeing on like Jerry Grossman and AATBS. Scheduling your wear for 20 minutes each night at 8 p.m. That's you prescribing that symptom. If that symptom is continuing to keep happening, okay, how about we put a time limit on it? Worry for 20 minutes and that's it, right? Encouraging the problem behavior. I would like to argue every night this week at exactly 7 p.m. for 15 minutes, right? Okay, if that's what your problem is, then okay, hey, let's do it, right? You want to argue every night, but you can only do it for 15 minutes. And then there's the restraining, where the therapist will tell you, hey, don't change this week. Just leave it the same way it is. Do the same thing that you've been doing just to see how it's going to go, right? And then there's that good old ordeal. Each time your son has a tantrum, have him clean the garage afterwards, because then that son gonna get tired of cleaning that garage. So what's gonna happen? Those tantrums are going to decrease. That is the ordeal. Now it's like, ooh, should I keep this symptom or do I just give it up? That's an ordeal. I hope that makes sense. Now, ending phase. This is the ending phase. This is where you're going to be looking for success, reviewing things. Once that symptom has been resolved, therapy ends. When you get a vignette that says the symptom was no longer there, so the parents and the family or whatever did not return to therapy, what should the strategic therapist do? If you get a response that says, call the family back for therapy, do not choose it. The symptom was resolved. Therapy is over with. There is no prolonged emotional closure. So the therapist ain't calling you saying, hey, you want to come back and do a final session. They ain't doing that. The goals are met. Therapy is terminated. That is the best thing about strategic therapy. If the symptom no longer exists and the pattern has been disrupted, therapy ends. That's the most clearest termination phase that you can ever see in any of these models. Don't be calling them parents asking them to come back, because they shouldn't come back. It's strategic therapy and plus is brief, right? Here it is. Recognizing the questions on the exam. If that question does not say, as a strategic therapist, what would you do? How would you be able to recognize that it is a strategic therapist question without them mentioning strategic therapist? You need to look for clues that are going to say something like this. Challenging a symptom, right? This is that sequence, those symptoms that continues to keep happening. If you see anything about them, assigning them a task that's going to challenge that symptom, that's strategic therapy. If you see that they use the terms like reframing, symptom prescription, it's automatically strategic therapy. If it's about termination and that therapist was just like, it was symptom relief, like they didn't return or whatever, that's automatically strategic therapy. No processing of emotions, no trying to figure out how this family is going to move on without the therapist or whatever, strategic therapy. When you see a vignette that is talking about the therapist is instructing, assigning, directing, telling that family what it is that they need to do, it's all about what the therapist is telling them to do and not what the client wants, strategic therapy. Look for terms, symptoms. Look for terms that are going to say something like, just like the question that we just had this morning, consistent arguing, frequent arguments, consistently still doing the same things over and over and over again. That tells me that they are stuck in a disabling sequence and it's strategic therapy. You must know how to answer these questions on the exam. Do not glaze over a strategic therapy question because you might miss something. Sometimes strategic therapy, you have to be just like, pay attention to the details. Like the 2 questions that I posted this morning and talked about. You have to pay attention to the details. Do not pick up, if there's another response that is a more specific paradoxical intervention or something about prescribing a symptom, that one definitely is going to be correct. Because if you looked at the examples I gave you, it is like clear and attainable goals that they are giving them when it comes to them prescribing a symptom or giving them a directive in order for them to do. Don't pick something that just says, give them a paradoxical intervention. However, if that is the only response that includes a strategic therapy response, then that one possibly is going to be correct. If it says give them a paradoxical intervention and the rest of those other responses is something about Bowen, contextual, and it has nothing to do with the vignette, then that answer is possibly correct. However, if there are responses on there that is much more specific in nature that describes prescribing a symptom, such as what we talked about, are you this night for 15 minutes? Are you this days on this day's week? That one has to be the correct answer. I have yet to see an answer that is not specific in nature when it comes to a strategic therapist response. I hope this makes sense. I hope I have explained this theory good enough. If I have not, please let me know if there's something that you do not understand, and I will try my best to make you understand it. but let's just do a review. How are we feeling about strategic therapy? Because strategic therapy was on my exam, so I just want everybody to be prepared. Have fun with this model. Make it silly, because some of the responses and stuff are absurd, especially when it comes to prescribing a symptom. Make it fun for you. Don't be so anxious when you're trying to learn about it, because this model is actually, it's pretty straightforward if you really look at it. And I hope that I was able to make this straightforward for each and every one of you. But again, like, I'm really stuck on, like, if you're struggling with the model, try to apply it. Apply it with your clients, apply it with your family, apply it with your friends, especially like when it comes to the different the paradoxical interventions, like the ordeals and stuff. I love it. I use that with my clients all the time. I do ordeals. I do prescribing the symptoms with my clients because I just want to stay fresh. I just want to make sure that I have an understanding of it. And typically they work. You would be surprised how much these interventions actually work with the clients or whatever. One of the biggest things is you are going to have to recognize strategic therapy language. I need you to be able to recognize it. So just in case that question does not say, as a strategic therapist, you automatically know that this vignette screams strategic therapy to me based on the language that is being used. I hope this makes sense. I will see you all later.